This is a very brief summary from my client who is almost late to go chase an airplane, so we're going to do the briefest comment on her experience here at the Hesch Institute.
Well, yes, first of all, I'd like to say thanks to Jerry for uncovering some symptoms and other aspects of my body that no one had previously discovered. And probably the most significant was a dysfunction or an overly large spacing in the pubic bones that prior to coming down here and meeting with Jerry, I had been to various practitioners for the last 15 plus years, and no one had pointed out that information on the x-rays or discussed that kind of a situation with me, except for a prolotherapist I had treated with in Phoenix, who did notice that there was a lot of laxity in the pubic area. And I found Jerry's evaluation to be the most thorough I've probably ever had. We've spent several hours for the past 4 days uncovering new discoveries pretty much every day. So I would have to say that it's definitely been by far the most thorough and hopefully the most effective therapy I'm going to get.
Thank you. And so do you now feel empowered to address the laxity that you have in the pelvic joints?
I do feel empowered. I am hoping that time will prove that all of these issues are going to resolve for me, and I'm very hopeful in that regard.
And prior you were using an SI belt at the level of the SI joints. Where are you going to wear it now?
I'm going to wear it down lower so it provides some stability for the pubic area, and that should do the trick.
Very good. And you have a good sense of the strengthening that you need to do, especially Kegels, right?
Oh, yes.
Good. And Brian, you want to add anything?
You know, I don't really have anything to add other than what was already stated by my wife, and I definitely in agreement with her that a lot of these issues have been addressed that were not addressed previously, and I think gave her a lot of hope that she could see some definite improvement. And issues, because not being addressed, were kind of foreign to her body, but now that her body's readjusting to that, she seems to be doing much better, so I'm very happy.
So what are your thoughts on me calling this the Hesch method versus physical therapy?
Well, it's completely different from any physical therapy I've had. So it's a unique method that is uniquely you.
And when I treat joint restrictions, is that different from other joint treatments you've had?
Oh, yes, definitely.
How so?
Well, it's different from an osteopathic approach, and it's also different from your typical chiropractor approach. I don't know how else to describe it. The spring tests are unique. I've never had that before.
And the treatment takes how long does the treatment take? That's kind of where I'm headed.
As far as the testing?
Not the testing, the treatment. When I work to restore motion in any joint anywhere that's restricted.
It is far longer. I mean, normally it's a very quick adjustment.
Right.
And there's popping involved. Right. Your method is more letting the body relax into an object, and the body itself adjusting, in essence, adjusting itself.
I like the wording there. That's a great place for me to stop. Thank you. I really appreciate your thoughts and sharing that.
Well, thank you.